I'm Ginny Weathers. I'm a gynecologist. Have I met any of y'all before? No, not in clinic or anything. Okay. So I am a board certified obstetrician gynecologist. No babies anymore. We don't do OB at Grand River. So now I'm just doing gynecology and women's health. And I love teenagers, especially obviously female teens. So that's what I'm doing now. I mean, I do hysterectomies, hormones, all this stuff, but I do love my teenagers the best. So anyway, and I love I love a good uterus. They're so cute. Okay, so just like, why are we here? Like, obviously, all of y'all are teenagers, I'm assuming, or in that like 20 or 12 to 20 age range. So like, why are we here? To take care of our teen girls and make sure that everyone's getting the care that they need and, you know, getting the information that they need. Like education, right? Like as everyone's going through puberty and maturity and menstrual cycles, like let's talk about what's normal, what's not. Kind of like destigmatize it, you know? I mean, this is gonna be I'm a very blunt, like open person, so it's impossible to be a gynecologist and not talk openly about vaginas. So like, it's like, okay, let's talk about it. You know, we all have them, those of us that are women. Usually have menstrual cycles, so let's just make it like a common thing to talk about, you know, or a comfortable thing, I should say. Like, you don't need to talk about it at the grocery store, but, you know, feel comfortable talking to your mom about it, or your friend, or like coming to the doctor. I can't tell you how many people I'll ask family history, and they're like, I have no idea. My mom never talked about her periods or her hysterectomy, and I have no idea it was like a super secretive topic. So I just want it to not be that way. So yeah, welcome. So anyway, but I want this to be like, yeah, just really informal. Like I'm just gonna sit up here and talk about what I do. Y'all are welcome to stop me at any time and just ask questions in the middle. Obviously at the end we can too, but yeah, just, I'm not a formal person. This does not need to be a formal thing. But anyway, yeah, like welcome. Thank y'all for coming. I was just saying we're here for our teenagers. Like that's why I wanted to do this, and that's why I love my job and I'm passionate about it. I also have 2 little girls that'll at some point be teenagers, and I want good female care for them as well. I kind of got into this because I myself had a really not fun experience with a gynecologist when I was 16 and needing birth control. And like, I remember some old man walked in the room and I was terrified, and it was just like such a bad experience. And I remember I was kind of nervous to talk to my mom about it. And I just want that to not happen for our teenagers going forward. Like it doesn't need to be creepy or weird, or, you know, no one's ever gonna like enjoy a vaginal exam, which you'll see in the next slide, you probably don't even need. But I just wanted to be like, okay, you're going to the doctor and let's like not make a huge deal out of it, you know? And so anyway, so that's kind of, you know, I think also like, yeah, knowledge is power. Social media obviously is everywhere. We can't get away from that now. I think it can be good and bad. That could be a whole other discussion. But I think as far as female, like reproductive, you know, like menstrual cycle stuff, I think it actually can be helpful because it's out there so much that I think it does make our teens feel a little more comfortable talking about it. I think there's also just so much misinformation that comes with that is like, I don't know, the bane of my existence when I'm seeing patients in clinic. I'm like, oh, okay, you read that on the internet, great, that's probably completely false. So anyway, okay, so just kind of like starting out, when do you see a gynecologist as a teenager? So ACOG, which is American College of OB-GYN, says around 13 to 15. I think that's pretty young. I think if everything is fine and you're not having any big female issues, I think 15 to 17 is a totally fine time. I think really before you go off to college is a great, like if you haven't been seen by a gynecologist, senior year of high school, before you go off to college or into the world is a good time. Obviously, if you're having a problem issue, like painful periods, we'll get into all that, you know, please come and see me. But I think for like just a, you know, teenager that's having periods and she's 13, doesn't need to see a gynecologist just yet. That might be like almost traumatizing. But I think it's really about getting in, you know, for most teenagers, that's usually, I guess you've seen pediatricians, but by the time I see adolescents, they haven't really seen a pediatrician for a while. And when they did, they were like 10 or something and just kind of getting their shots, or I don't know, whatever you do at a visit at 10. But like, I feel like the gynecology visit when you're a teenager is like the time for you to be like, okay, I am a patient. I am slowly turning into adult, even though we maybe don't want to think that. But, you know, like take responsibility for your, like being able to describe your body, talk about your like medical decisions. You know, I think it's like really empowering. It's kind of like your first visit. That's like really you, not like a 10-year-old accompanied by your parent at the pediatrician, just kind of like doing the deal, but like really being like, yeah, this is what's going on with me. These are the decisions I want to make, et cetera. So I think it's like I have some gals that'll just bring their 15-year-olds in for just an intro and just a meet and greet and just say, hey, like we don't need to do anything today. Let's just talk about your periods and, you know, just like building trust. So I think that's really important. Pap smear started at age 21. Usually my teenagers, there is no need for a vaginal exam. I usually don't actually do any physical exam. I mean, unless it's necessary and like there's a problem visit, but usually that's like, once I say that, you know, I can see like the wave of relief like falling over everyone's face. So usually there's no need to do anything vaginally until you're 21, with a few exceptions. And certainly if you're having a problem visit, like vaginal discharge, I mean, there's a few specific things, or like an IUD placement. Obviously we have to do a vaginal exam for that. But usually everyone's like really excited to hear that part. I will say, so most of my girls are coming in with their moms. I'll just say mom because legal guardian, father, whoever, but it's almost always mom. And I really encourage this to happen. I mean, legally, teenagers can see the gynecologist by themselves. I really promote, like, let's have your mom in the room. Let's all make decisions together. You know, if it's just like my periods are painful and we're deciding a treatment for that, or if it's like I need birth control, you know, and if I have an adolescent that comes by themselves, I will ask like, hey, is your mom in the waiting room? And if they are, I'll usually try to pull them in. If your mom's not here, could we put her on speakerphone? So like, I really, really try to encourage moms to be part of the visit. Now, with that being said, that will happen for I'll have the teen and mom for most of the visit, and then at the very end, I will have the mom step out and like let the teenager get her own time and private time. But anyway, I just really encourage it to be like, you know, parents involved, you know. So anyway, just want to say that. Okay. So like typical topics that we'll talk about. I mean, really just like, when did your periods start? What are they like? How frequent are they? Are they heavy? Are they painful? I mean, really, a lot of people think that like your menstrual cycle is kind of a, 6th or 7th vital sign. I mean, that's, at least as a gynecologist, it is for me. Like, I can kind of see what your periods are like and say, okay, that sounds pretty good. Or like, woo, we got some hormonal issues. Like, let's delve more into that. Just talking about normal female anatomy, like what's normal, what's not. I have another slide, like kind of normal discharge. I mean, just kind of like establishing norms. I know the labia minora are getting a lot of attention these days, and I've seen quite a few teenagers that come in thinking their labia are too long or they're asymmetric, and they want to talk about that. So anyway, just kind of discussing that. How to use tampons is actually a really common thing that I see, and I will go into like options as to help that. I will sometimes place a tampon for the patient themselves, holding a mirror. I mean, there's lots of different ways we can do that, but that's a really common thing I hear. Talking about hormonal treatment for like non-pregnancy prevention reasons, like again, heavy painful periods are the most common for that. For my patients that are sexually active, you know, let's talk about that. Do they need to get on birth control to prevent pregnancy? We'll talk about that. And then STI testing, which just screening for infections. I like also just, you know, I mean, like in regards to periods, like, are you missing school because your periods are so heavy and painful? Are you bleeding through your sheets? You know, are you having to bring like a change of clothes in? I mean, those are all things that are like really helpful to know. I also do like a good bit of just social history. I mean, I think I kind of base it on like what my patient's there for, but you know, where are you in school? How are you doing in school? How are your relationships? Who do you live with at home? Do you feel safe? Any history of abuse? Like smoking, drug use, you know, eating disorders, and just, promoting healthy relationships. So if the patient feels like they need, like I kind of read my patient, if they need a little bit more with that, like delve into that. If it seems like they're doing fine, we'll kind of move on. So, okay, just like talking about normals. So most of y'all maybe have had a period in here, but you don't have to announce it. But most of the time, 11 to 13 is about the average age. If someone's 15 or 16 and hasn't had a period, it's probably a good idea to come in and like, let's just investigate and see what's going on. Every frequency, so every 21 to 45 days is what we consider a normal period. Flow, usually like no longer than 7 days. So like, I guess, 3 to 7 is normal, but anything longer than 7, we consider like a pretty long period that like maybe is problematic. And then like the actual amount that you bleed can be really hard. I mean, obviously you're using pads. I mean, I guess menstrual cups, maybe you could say you can measure that a little bit better, but you know, you're using pads or tampons, it can be hard. Some women will just change their pad every 2 hours because they like hate it having any blood on it. Some people are like actually soaking them every 2 hours. So that's kind of a tough one. But yeah, I mean, no more than 4 to 5 pads or tampons a day. Or you can also say like if you're soaking a pad or a tampon every 1 to 2 hours for a day or two, that's really heavy. So yeah, like just kind of talking about normal period cramps. Will typically start 1 to 2 days before your period, usually last about 3 to 4 days into your cycle. And that's gonna be a totally normal thing. So I mean, again, if someone's just like, I don't know, I have these crazy cramps and you know, they're happening X, Y, and Z, I can kind of tell you. Intestinal symptoms, it's really common for women to get like nausea, vomiting, and diarrhea around their menstrual cycle as well. So again, just establishing like what's normal and what's not. Okay. So, okay, kind of to like the menstrual cycle concerns. So kind of touching on like a bleeding disorder. I mean, if I have someone that's bleeding too much, which again would be like longer than 7 days, like flooding your sheets, you know, like staining through your clothes, then we might have to look at like a bleeding disorder. Actually, 30% of adolescents with heavy menstrual cycles have a bleeding disorder. Von Willebrand's is, I don't know if anyone's heard of that, it's the most common. So if I have a patient that's being referred to me for heavy menstrual cycles, usually I'll do a review of systems. Like, I mean, it's another reason why it's so great having parents there, but ask mom, does anyone in the family have that? Any bleeding gums? Any, like, do you cut easy, or do you bleed easily when you get cut? Do you have like nosebleeds? I mean, there's kind of a whole like review of systems that we'll go over if I'm really worried about someone having like a true bleeding issue. And then we can obviously do blood tests for that. Other concerns like endometriosis, actually not unheard of in the adolescent population. It was maybe 20 years ago thought to be like non-existent in teenagers, but that's actually not true. It can be really difficult to diagnose, especially in teenagers, because primary dysmenorrhea, which is the medical term for just painful periods, is actually really common in teenagers. And sometimes they just have painful periods with no true pathology that's causing that. So anyway, doing kind of differentiating endo versus just painful periods could be sometimes almost impossible. You know, some of the standard tests that we diagnose endo with in our adults can be a little bit different in adolescents. So it's just something that's always on my mind. If someone has really painful periods and we can't get that pain under control after a couple different regimens, then I will probably pursue like an endometriosis workup a little bit further at that point. PCOS, I feel like everyone's mostly heard of that, polycystic ovarian syndrome. It's basically like a fancy way of saying a hormonal imbalance. I won't go into like too much detail about that, but it can be caused sometimes obesity. It can present with irregular menstrual cycles, sometimes like a lot of hair growth in the chin and the upper lip, severe acne, can lead to like metabolic syndrome, high cholesterol, high blood pressure, et cetera. So also something to kind of keep in mind for teenagers. It's really tough to diagnose it in teens. There's actually some specialists that say you really can't, because teenagers, you know, y'all's hormones are changing, and all of our, I mean, as we all went through that, it happened, but your hormones are still maturing, they're still changing, they fluctuate on a daily basis. That typically doesn't happen when you're, let's say, like 30 years old. So it can be really tough to kind of diagnose these like endocrine disorders such as like PCOS. And then the female athlete triad, I don't see that a ton, but that's basically our athletes or our teenagers that are athletes that stop having menstrual cycles. Most of the time it's usually because their BMI is too low, like they're too thin. But we can see it a lot in just women or our teenagers that are just very athletic and very aerobically athletic, like especially like track runners or cross country people. So anyway, just things to kind of keep in mind for that. Okay, so told y'all we're just putting it up there, but vaginal, so kind of more norms. I mean, I kind of touched on this earlier, like what's normal. Vaginal discharge, very normal. White or clear is what we're going to expect. Anything other than that, like anything that's stinky, itchy, yellow or green is not normal. It's not super common, at least that I see in my practice, but I mean, certainly yeast and bacterial infections, we see them all the time in women. I don't see them a ton in my teenagers, but anything can happen. This is just a descriptor of female anatomy. So your labia minora are going to be these right here, and those are the part of your vulva that I was saying have gotten a lot of attention lately, and everyone, I don't know if it's like a social media thing, but everyone seems to think that their labia are too big and too long and they want them cut off, and we don't usually go there, and we'll kind of like have a really in-depth conversation. I mean, if for some reason they're long enough that they're causing you chafing or rubbing, interfering with tampon use or intercourse, then okay, we can talk about it. But for the most part, it's usually just education and kind of reassurance that everything is hopefully, everything is normal. Okay, so I'm just going to talk about non-hormonal treatment options that we use for common issues. So heavy periods, that's, again, I touched on that, something we see all the time. So a really common medication that we'll use for that is this crazy word called tranexamic acid. It's basically a medication that you take and it just slows down the amount that you bleed from like anywhere in your body. Obviously, if you're in your period, then it'll slow down your menstrual cycle. But even if you were to like cut your arm, it would slow down the bleeding there. Anyway, really common medication that we can use if someone's not wanting to go for like a hormonal option. And then for painful periods, another thing we see, I think painful periods probably more than heavy periods in my teenage population. But anti-inflammatory therapy could be excellent for this. And that's like Advil or Aleve, over the counter. Those are the frequency and dosage. Really, the takeaway for this is starting it before your period starts. And that's, I think, where a lot of people will be like, oh, my cramps are terrible. And then finally took, like 200 of Advil. And I'm like, that's not going to do anything. So it's really like, I was saying, your like menstrual cramps usually start like a day or two before your cycle. So like the second those cramps start, like go ahead and start taking scheduled, not as needed. It's kind of like the pillars of just pain therapy. And pain management is starting all that medication like before your pain gets really bad. So yeah, before bleeding, take scheduled, huge takeaway for the painful periods. And sometimes that's like all my teenagers need. Like we don't even need to go. I mean, if something is getting worse, we can talk about prescription strength anti-inflammatory, which is basically just like a super strength Advil, which works really well. But I'd say for like half of my teens, like just getting on like scheduled Advil can work really well. Okay, so then now we're moving on to hormonal treatment. So there's so many reasons that we use hormones, especially in my teenagers, that's other than to prevent pregnancy. I know we've kind of hammered these topics in a bit, but heavy and painful periods. Accutane use is actually, I see that probably say like 10% of have any of y'all been on Accutane? Anyone use that? No? Okay. It's for acne. I don't know if anyone knows that. But anyway, it's you have to be, I guess if you have never been sexually active, maybe you don't have to be on hormonal birth control at all, but typically it's required. I don't prescribe Accutane, but I get a lot of referrals for like my teenagers that are going in Accutane, and it's required that you have to use backup contraception because it will harm a fetus if a pregnancy occurs. Acne, really common, PMS, PCOS, like I talked about before, and then irregular menstrual cycles, like girls who'll go every 3 to 4 months without having a period, or those who are having like 3 periods a month. So, okay, moving on to just like, okay, let's say we've decided that, okay, you're having really heavy and painful periods. Let's talk about the options and like what we're going to work. I mean, really the best option is what you're going to use. I mean, there's so many different options, and I'll get into that in a minute, but like, be realistic. You know, if you have trouble taking your whatever pill you take every day, then let's not have you leave with a birth, you know. And again, I will say, I'm going to call this birth control, but it's just hormonal therapy. It's just honestly easier to say birth control. I know like what I'm talking about right now is not preventing pregnancy, but I'll just kind of use those terms like interchangeably. But yeah, like, you know, what we actually use, if you're not going to take a daily pill, let's not have you leave with a daily pill. That probably wouldn't be very smart, although that happens a lot. And what are you interested in? Like, I'll have a lot of girls that will come in and say, I have a friend who has an Explanon, and I think that sounds really nice, or I don't know, I read this on the internet or whatever. Like, what are you interested in? I'll talk to you about everything, but you know, what sounds like something you're, you know, yeah, just what are your thoughts? Do you want something you have to manage on your own, like a pill, the patch, or the ring? You can start and stop those on your own. It kind of gives you the privacy of like, I don't know, keep it in your purse or whatever, dealing with it on your own, or do you want something you never have to think about, like an IUD or the implant? Do you want periods or not? There's a lot of birth controls out there or hormonal therapy that will stop your menstrual cycles altogether. For some of our girls, they really need that. Like their periods are horrible, they're heavy, they're anemic, they're iron deficient, and so like we need to stop their periods. But I have some girls that get really uncomfortable with that, and they want to bleed every month just to, you know, kind of tell themselves everything is normal. I will say it is completely okay and safe to not have a period on hormonal therapy. Like it's not gonna hurt you, you're not like building period up inside of you. As long as you're on hormonal therapy, it's okay to not bleed every month. It's actually kind of an artificially created thing that whoever invented birth control in the 1950s made this weekly bleed occur when you're on birth control, but you actually don't need to, like from a medical standpoint, that does not need to happen. Now, if you're not on birth control and you're not having a period, totally different deal. That's concerning. But some of these hormonal options, you will stop bleeding altogether, and that's okay and it's safe, and most of them are made to do that. Another thought is like athletes. I mean, obviously I see a lot of my teenagers do sports. So like my swimmers, like there's a patch. I've had a few girls that the patch kept falling off during their swimming, or like, is your skin really sensitive? Same thing with the patch, because it can really irritate your skin. I love this bottom line. I get asked this question all the time. No birth control that is FDA approved on the market in the US will ever hurt your fertility. I mean, I cannot tell you how many times I hear that question. Like, oh, I don't know, will this make me not have kids? It will not, which means yes, it will never hurt your ability to have children in the future. I think that's just a very important take home. No matter what social media or your friend or whatever says, like nothing on the market will ever hurt your ability to do that. Okay, so, another thing too is as long as a adolescent has actually started her menstrual cycle, that's really the only requirement. Sometimes I will see like a 12 or 13-year-old that's just having excruciating, again, the heavy and painful periods, and their mom is really nervous, like, oh, is she too young to start on birth control? As long as you've started your menstrual cycle, it is safe to go ahead and use hormonal treatment. Now, if you've never had a period before, we're not gonna go there just yet, and you wouldn't need to anyway. But it's another common question that I get. Again, it's probably less common that I'm having to do that with a 12-year-old, but I will see them that are, like I had this darling girl who had her first period, and it was really heavy, and she got really sick, and so sometimes things happen. But as long as you've had a menstrual cycle, it's okay to use hormones. All right, sorry, we already talked about that. Okay, so here are all the options. So I mean, I don't know how familiar all of y'all are with all of these, but anyway, the top is gonna be the daily pill, the weekly patch, or the monthly vaginal ring. Wait, this thing doesn't have a pointer, but anyway. Pill, the patch, and the ring, you can see that on the top. The progesterone only pill, there's the Depo-Provera shot, the Nexplanon, which is the implant that goes in your arm, and then the IUD. That's actually a copper IUD. Not that y'all really know or care, but anyway, that's not what I'm talking about right now because that doesn't have hormones, but anyway. Okay, so let's kind of go into these. So, okay, the pill, the patch, and the ring, those three on the very top are combined hormonal options, and so now I'm gonna break those down. Those have both estrogen and progesterone in them. These, I mean, all three of those types, you as the patient have to be responsible about taking those, like daily pill, weekly patch, monthly vaginal ring. And again, it's totally just a patient preference and like what you feel like dealing with. And if you don't feel like dealing with those, then let's get something long acting, and we'll talk about that in a second. But again, big thing is like, patient responsibility for those. Okay, so side effects with these are going to be like regular bleeding, headaches, migraines, nausea, breast tenderness. Am I leaving anything out? There is a slight blood clot risk when you use anything with estrogen in it. It's 7 per 10,000 women. So it's really low, but it's also something I will screen is just to make sure there's no clotting disorder, like too much clotting, like we were talking about people who bleed too much earlier. This is the opposite. Make sure that like no one's had a clotting disorder at a young age or had, their mom was on like a blood thinner since they were 20 or something. So just screening questions to ask. Weight gain is not commonly associated with these, despite, again, all the things that you will hear, like my friend had this and she gained 20 pounds. Like clinical data will show that actually weight gain is, there's only one birth control that's really associated with weight gain, and I'll talk about that in a minute. The only big contraindication for the combined, the pill, the patch, and the ring are migraines with aura, which I actually see. I feel sad because I know my husband has migraines. I know migraines are terrible, but I see a lot of teenagers with that. So those will be the girls that we really should not be using this type of hormonal treatment for. And yeah, so anyway, just something to think about for that too. Oh, and you can, so these are all, sorry. Okay, well, I don't have the right picture, but for most of these, like if you look at a pill pack, you'll have 3 weeks of regular pills and then 1 week of sugar pills. And that's kind of the pattern that those 3 birth control types, hormonal types, whatever you want to call it, copy. So you're basically like 3 weeks on, 1 week off, 3 weeks on, 1 week off. So if it's the vaginal ring, you leave the vaginal ring in your vagina for 3 weeks, take it out for a week to have a period, a patch. You will do 1 patch, then a second patch, then a third patch, take it off for that 4th week. You can kind of finagle with that. I mean, that's kind of what I do love about these. If someone's like wanting to deal with something on their own, is you can kind of manipulate it. And I mean that like in a good way, not in a like evil way. But if someone has like a really awful period and they don't want a period, you can actually go straight and take and only have a period every 3 months. You can even to have like never have a period and just continually take the sugar pill. Sorry, not the sugar pills, the like hormonal pills. Or continually use like a vaginal ring back to back to back. Same thing with the patch, just never take your patch off. So there are like, you kind of have a lot of wiggle room within these. And I do have quite a few gals that will just like have a period every 3 months and, anyway, and it is fine with them and they, like it. But it's usually because of their periods are heavy and painful and they don't want to deal with that once a month. So anyway, something to mention for that too. Okay, benefits for the pill, the patch, and the ring. Again, kind of hammering down this problem list again, but really like all of these, I mean, heavy periods, painful periods, acne, PMS, really this is the only birth control or hormonal type that's gonna help with acne. All the other types we'll talk about will not help with acne. So that's probably like acne, PMS, PCOS, and breast pain are gonna be very specific to like the estrogen, the pill, the patch, or the ring. Those symptoms are probably not gonna be helped with the other hormonal types. So anyway, lots of great things, and I mean you can see that's what 7 different medical issues that we can use hormonal treatment for. That's not for pregnancy prevention. So they're very, very helpful. I feel like a lot of my teens will come in and they'll be really weirded out by like, oh, I'm starting birth control and I don't want to get the stigma of being on birth control. And I really try to emphasize like this is FDA approved for many other uses other than pregnancy prevention. So just keep that in mind as well. And just, no one else needs to know if you're on birth control for your like really painful periods. It's not their business. Okay, other option, progestin-only pill. I'm just mentioning this to be complete. I don't love this one. You have to take this, be really good about taking it at the same time every day. It has a lot of side effects. It can cause some acne. It can cause like some water retention. It can cause irregular bleeding. It's really, again, probably for like, it's for those of y'all that have had babies, it's like the mini pill that you take when you breastfeed as well, but it's really kind of like a last-ditch effort if someone's like failed anything else and can't use estrogen. But not, like you have to be, if we're using it for birth control, you have to be like exact about taking it at the same time every day, which is just like not realistic. Okay, Depo-Provera. So an injection every 12 weeks. It can be really good at stopping your period. So again, someone with like heavy painful periods, and, going to anemia, like iron deficiency, it can completely stop your period after about 3 to 6 months. It is the only birth control that has like a known weight gain. About 5 to 10 pounds is the average. I've seen women gain like 20 to 50, and then I've seen a small population that didn't gain any weight at all. But it's probably like, this is my least favorite. But it's really, again, I think, and continuation rate in teens is really low. They don't usually, they'll do like 2 shots and then that's about it. But again, if I have someone that's like really anemic and I can't get their bleeding to stop and they've tried other options, this can be a good option. I just will educate them about the side effects for it. Okay, so, all right, next one. Okay, so the next one on. Are y'all familiar with this one? Everybody? No? Okay, so this is the implant and it goes in your arm like right here. We place it here in clinic. So this is now part of the long-acting reversible contraception category, meaning I place it or provider places it, it stays in your body till provider removes it, which a lot of people really love that option. It's actually the American Academy of Pediatrics and American College of OB-GYN recommend it as the first line contraception use for teenagers. It's super, super safe, very little risks. I know we're not talking about pregnancy prevention right now. It can help with heavy and painful bleeding. So again, if I have someone that's tried a pill or a patch and they want to, let's move on to a progesterone only option, the next one on can be a great option for that. The biggest side effect with it is unscheduled bleeding and spotting. It's usually not heavy and it's usually not painful, but it can be annoying and there's like no way to predict it. I'd say most of my teenagers don't really get that bothered by it if they do have it, because I don't know, they don't usually tell me about it, but anyway, great. It's excellent at pregnancy prevention, but it can also, I've also used it for some girls that still have really torturous periods. The placement is really easy, especially as opposed to like an IUD. We just numb your arm up here, put it in, it takes about 3 minutes, like super easy. But you do have to, you will have like be able to feel it under your skin. So I have like a few special needs patients that, like with autistic patients that will pick. And then I just have some girls that are like, no, that weirds me out. So anyway, but it's super, super popular in my teenagers. And it can be removed whenever. This is in your body, but like it's good for 3 years. If you hate it or whatever else, you're having some weird side effect, you can come in and we can remove it whenever. Okay, so here is moving on to the progesterone IUDs. So the Mirena and Liletta are the 8-year one, the Kyleena is the 5-year one, and there is the Skyla, that's the 3-year one. Y'all are my teen population. The most common I place is the Kyleena. It's the smallest. Actually, the Kyleena and the Skyla are the small, they're both the exact same size. I just feel like if you're gonna go through all that and get an IUD, just get one that has 2 more years of life on it so you don't have to replace it. So I really don't place many Skylas at all. The Kyleena is by far the most popular for my adolescent. It's mostly for my patients that have had sex before, not always. I actually have some really tough teens that have never been sexually active and have really struggled with their periods being heavy or painful, and we have opted for a progesterone IUD because it usually will stop your periods. And they've done really well, and they've been able to tolerate a pelvic exam, because that's not easy. If you have never been sexually active, having a pelvic exam is tough. It's obviously a very sensitive area of your body, and the vaginal opening is really narrow, but I've had some teens that have done really well with that. And again, this is a lot of time, I didn't put that up here, but most of the time it will either stop your periods or it'll be really light, like maybe just random spotting every few months or just like a really light period every month. So that can, but again, it's, I tread lightly if I have someone that's never been sexually active, because that is a big exam to undergo, and I will offer it if it seems appropriate, and if not, totally fine. And the Mirena is FDA approved for heavy periods. The Mirena is a little bit bigger, so I don't use it in my teens quite as often. The insertion is everyone's biggest fear with this, and there's kind of no way to get around it. It's a painful procedure. I've had one done myself before I had kids. I totally understand and empathize with everything someone's going through when they're getting an IUD placed. All I can say is I've like perfected the art of inserting an IUD as like much as humanly possible. So like we can use Advil beforehand. If someone gets really anxious, like we can talk about like a Xanax or something. There's just really no great way to like numb the uterus up. Like it's actually impossible. So I'll kind of talk to my patients to just feel them out. If I have someone that's like having a panic attack about getting it, then we'll talk about, we can do some local numbing and kind of talk about some options. I will say that's never happened in my career. Okay, maybe once, that I had to take someone to the operating room to place an IUD. That's really, really rare. It takes me about 2 minutes and 40 seconds to place an IUD. So really just get in there and get it over with. It's kind of my motto. And I don't mean that in a barbaric way. I just mean like kind of the faster we can do it, the faster it goes. But anyway, I'd say everyone's like kind of terrified about the insertion, and I'm like, I get it, we gotcha. I have like a whole procedure tray that Brittany's very nicely helped me make. It's got like cookies and juice and like lavender oils. I mean, we have all the things for like, if anyone needs some support during that kind of stuff. So anyway, but yeah, that's always the biggest concern, is just like having it. And then this would be an example, obviously, of having a vaginal exam before the age of 21, because obviously we have to do a vaginal exam to place an IUD. You know what I didn't think of? I didn't have a picture up to actually show you where the IUD goes. I didn't explain that. The IUD actually goes inside the uterine cavity, which, hang on. Which is like here. So like, I know this is a silly uterus, but so like here's the uterus. The IUD is gonna go like here. So these are your tubes. This is the ovary. This is supposed to be your cervix, and your vagina is down here. So the NuvaRing will like sit right there. The IUD is actually gonna be like inside the uterus, like up in the muscular part, which is why we have to place it, obviously. Okay, anyway, I should have just talked about pregnancy and being sexually active. That's, I'd say, probably about half of what I see visits for, or like I'll have my teenagers that'll start off like with heavy and painful periods, and then eventually they will become sexually active. So, the teen birth rate is historically low, which is amazing, and it's due to mostly because of the Nexplanon and that IUD that I talked about. They're just so safe, so effective, and you don't have to manage them. The U.S. still has the highest teen pregnancy rate, which is really dismal to me, but you can see that Colorado has a lower teen pregnancy rate because Colorado has a lot more grants for like funding for mostly the long-acting birth control. Okay, so when I'm seeing a teenager, obviously I'm never encouraging anyone to be sexually active. I am there for my teens if they're seeing me and they have chosen to become sexually active and they need to talk about birth control, STD testing, like I'm there for them. We'll have a discussion, like, are you being safe? Does your mom know about this? I highly encourage my teenagers to tell their parents. I can't force them, and legally they can see me for birth control without the consent of their parent, but that's not like my mantra. It's like, okay, and usually my teen is coming in with their mom. I'd say maybe like 75% of the time they're really open with their parent. When they step out at the end, I have a 25% that is like, well, actually, yeah, I am having sex. And I'm like, okay, so like, let's talk about that. And at that point, I'm like, please tell your parent or your mom. For most everybody, it's your mom, but like, please be honest with them. If you are gonna start birth control, again, legally they can take birth control without their parent knowing, but I don't like that. I want everyone to be open, and if they have any issues or any complications, I want their mom to be in the know. So I'm a huge proponent of that. But like, yeah, if our teenagers are gonna have sex, like, let's make it as safe as possible. Let's take care of them. Let's prevent teen pregnancy. Let's prevent STD STD infections. Let's just support our teens as much as they can. I always encourage dual methods. So like birth control, like hormonal birth control can prevent pregnancy, but it's not going to prevent STDs. So birth control plus condoms. Condoms are your key to preventing STDs. Okay, and a couple non-hormonal options. I hope I didn't confuse this too much by the way I grouped everything, but the Paragard is another type of IUD that is copper, and it's going to be it's good for up to 10 years. It's the only non-hormonal option. I think that's really important for people to know. It's not super popular because it will make your periods, or may make your periods heavier and more painful. But for someone that really wants like zero hormones, this is a great choice. And as you can see, it's 99.8% effective, so it's really effective. Just for comparison purposes, condoms or the withdrawal method, not very effective. So that's why we always encourage the dual method. Okay, hang on, I'm gonna get it. Okay. All right, so just talking about like efficacy of birth control, like how effective are these? So I mean, I kind of hammered in the long-acting reversible. That's the Nexplanon, the implant in your arm, which, well, I have a little thing up here. And the IUD, I have like show and tell up here if y'all want to look afterwards. But those are the most effective, again, endorsed by ACOG and American Academy of Pediatrics as first-line birth control for teenagers. You can see they all are like amazing at their efficacy. The pill, the patch, and the ring, if you take it like as directed, which not everyone does, about 92 to 96%. Depo-Provera is that shot every 12 weeks, same thing. And then the progestin-only pills, like 90, 94%, which is why I don't really encourage those. Okay, so IUD types. I know I kind of already went over the progesterone ones, but I just wanted to compare them. So the progesterone ones, which is like the Kyleena or the Mirena, versus the Paragard, which is the copper, just to kind of give you some comparisons. The big difference is progesterone is probably going to stop your periods or make them really light. The Paragard is not going to do that at all, may make them worse. Really, the only indication for the Paragard is only for pregnancy prevention. It will do nothing for any medical, like gynecologic issues. But anyway, yeah, so we kind of already went over those, but to see that again. Okay, so I just have like a few cases at the very end. So, okay, this is a really common thing I see. I'll see like a 16-year-old who has been struggling with like heavy, painful, or irregular periods. We've tried maybe like two or three different kind of birth control pills, and they'll do well with one, and then like 6 or 8 months later, their symptoms will come back, and then like we kind of try maybe 2 or 3 kinds. And then at that point, I'm like, okay, we need to give up the pills. Let's move on to something totally different. And this gal got a Kyleena. I'd say usually at that point, we kind of talk about, okay, let's try like a progesterone IUD or an Nexplanon. Because again, teenagers, your hormones change, they're still maturing. So like you might be like totally sold on one birth control and your body might love it. And then like your hormones change again, and 6 months later, you know, all hell's breaking loose and like your periods are all crazy again. So at that point, I will usually say, if you've tried a few pills options, like let's move on to something totally different. So just kind of just a good example of why we try to change it up, you know, and not hammer the same thing. Okay, another case. So a 16-year-old. This happens all the time. A 16-year-old that's like, okay, my periods are painful. Oh, by the way, yes, I am sexually active. And like we go through the whole spiel, and she's like, okay, yeah, I want a pill. And then I'm like, okay, like you're on Zoloft or whatever. Like how often do you take that? Well, I skip it like twice a week. So, okay, pills obviously not gonna be. I feel like all my teens, like the pill sounds like the easiest and maybe they know it the most. But it is honestly, I'd say not like probably very, you know, not very frequently is it like the best option because again, our lives are crazy. I know even if I had to take a pill at the same time every day, I'd probably really suck at it. So yeah, I think just, you know, being real with yourself. Like, so she ended up going with the Nexplanon because she was like, well, actually, I mean, maybe I should explain, if you miss pills in your birth control pills, it will not prevent pregnancy, or it will also not help with your periods being heavy or painful or whatever we're using it for. So it's really key that you take it at the same time every day. So anyway, I see this a lot. And then this is another, again, why I really push for my seniors in high school to come in. So like a girl in high school, or a senior in high school, going off to college, like maybe she's sexually active, maybe not, you know, maybe she wants to become, and probably will in the future at college. Same thing, kind of talking about a pill. And then she's like, well, you know, okay, let's just go for an IUD. We put in the Kyleena. She doesn't have to think about anything for 5 years, and she's good to go. So those are like 3 really common scenarios I see a lot. Okay, this is my last slide here, but basically just STI testing. I mean, anyone who is sexually active from the ages of 15 to 24 needs STI testing every year, and that includes a gonorrhea and a chlamydia test. and then an HIV at least once. We can do that without doing a vaginal exam. You can, a lot of times, actually the most recent, I used to do a urine test. Sorry, I'm like talking over myself. A urine test. They've actually shown that a self swab, like vaginal swab, is actually superior. So a lot of times I'll just give my patients a swab. They do the vaginal swab themselves. Obviously I leave them in the room and give them privacy, and then we send that off. So again, no vaginal exam is necessary for that. Chlamydial infections and gonorrheal infections are almost always, or very frequently asymptomatic. I hear a lot of like, oh, I'm not having any symptoms. I'm like, that means nothing. So, just keep that in mind. And even one chlamydial infection can cause infertility rates up to 10%. So I'm a huge proponent on please just test. Like if you've ever had sex, let's just test. I always tell patients a negative test never hurts anybody. And if it's positive, we caught it, we can easily treat it.